Today, I'm going to talk about COVID vaccines again, but with a bit more data as to why we should be getting them. I think repetition is key here in getting a good understanding. We're getting suited and quote unquote boosted. A bit of what we know as a refresher: COVID, short form for coronavirus, which is a virus that manifests with respiratory, constitutional, and gastrointestinal symptoms. Respiratory symptoms are the sneezing, the cough, the shortness of breath. The constitutional symptoms are more the headache, fever, chills, and the muscle pain. The GI symptoms are more so the nausea, vomiting. And another throat symptom that's not necessarily respiratory, of course, is the sore throat, as well as runny nose being part of the respiratory system. Aside from the symptoms of acute COVID, we also have the symptoms of long COVID, which is continued coughing or breathing problems, a loss of smell or change in taste, persistent body aches, headaches, chest pain, stomach pain. So those are more of the similar symptoms compared to short-term COVID. But what's the difference here is that these symptoms persist for months to years after the initial diagnosis. And some other symptoms that separate short COVID from long COVID are the trouble sleeping, brain fog, fever, that's cyclic. When I say cyclic, coming and going. And again, this is persistent for months afterwards. And then fatigue as well as mood changes. There are other symptoms as well that we continue to discover as more research is done on long COVID. How is COVID spread? If you look more on the left side, you have an individual sneezing, coughing, talking, and because of that, you expel a lot of the COVID droplets. Those are the wavy yellow lines that you're seeing, the respiratory particles traveling in the air. Unfortunately, if there's someone in a certain vicinity of the talking, coughing, sneezing, these respiratory particles can land anywhere in your T-zone area. T-zone comprising of your eyes, your nose, your mouth, and you inhale it, you get it on your body surface, and that's how somebody can transmit COVID from one person to another. So not just person-to-person transmission. If these particles land on a surface and somebody else comes by without gloves or doesn't practice good hand hygiene, if you touch that surface and then get anywhere in your own T-zone, that's another way to spread COVID. And so depending on the surface, some of these respiratory COVID particles can stay on that surface for up to 5 or 7 days after. So this is why a lot of people in the early days and even now are really practicing aggressive surface cleaning and decontamination to minimize all the spread. Aside from being in close proximity with someone or like touching a surface, other places that are high risk are schools, offices, public transportation, nursing home, because all of these spaces are enclosed areas. If you share a bathroom with an individual, many individuals, contaminated surfaces where the viral particles can also be on those surfaces and be a source of infection. This is also why people were like opening windows in areas for a time in order to usher those viral particles away and out. What's the treatment? So for any virus, most of the time an antibiotic is not prescribed. The reason why antibiotics are to treat bacterial infections versus antivirals are to treat viruses. Again, antivirals are to treat viruses and antibacterials are to treat bacterial infection. So most of the time, COVID and other viruses are treated with what we call symptomatic treatment, which is that you treat the symptoms. So in instances of hydration, you're treating folks who aren't able to eat foods or drink fluids as well as they can. So we really encourage you to stay hydrated with water, with electrolyte containing water. I know people enjoy Gatorade. I know there's some other very popular electrolyte repletion fluids there. It's your own choice. Hydration is important. If you're having a fever, Tylenol is what helps you reduce the fever. Ibuprofen is helpful more so for the muscle aches and body aches. That is a constitutional symptom, as I was talking about, associated with COVID, but it can also help with fever. Steam showers really to help that decongestion. Same with vapor rub as well to help that decongestion. Notice how I didn't say that these are treating COVID specifically. These are treating the symptoms associated with COVID infection. And these treatments typically help folks get through the symptoms and you let the virus run its course. So those are mild to more so moderate cases of COVID. If the virus progresses and God forbid the individual ends up needing hospitalization, the antivirals that could be prescribed in those cases are called Paxlovid, remdesivir, or molnupiravir. Now, these are just fancy names. The bottom line is that you are not going to automatically get these antivirals. It depends on how long you've been sick for and if you have any other health conditions that may make one of these antivirals a better choice for you compared to others. And these antivirals differ in terms of how long the individual is given these antivirals for. And again, you might not get these. So don't automatically think that if you're going to be admitted to the hospital, boom, you're going to get these antivirals. It really depends on how long you've been sick for and if you have any other health conditions, because these antivirals may not benefit you depending on your situation. The COVID infection, as I said, is a viral infection, but unfortunately, you might get a bacterial infection on top of that. And that's because your body's immune system isn't as robust and strong enough to battle off bacterial infections as well as they can if you are affected with severe COVID. And so, as a coronavirus is a virus that primarily hurts your lungs, you might get a bacterial pneumonia aside from a viral pneumonia. Pneumonia being an infection of the lung, and the infection of the lung might be viral, such as coronavirus or any other virus that affects the lung, or a bacterial infection on top of your viral infection because your immune system isn't as strong as it could have been. If you do get a bacterial infection, then you would be given the antibacterial. But we want our folks and patients and audience not to even get to the state of needing treatment. But if you did need treatment, this would be your treatment course in a very brief understanding. But we want to even prevent this from happening. This is why hand washing is still very important. Sing your happy birthday as you're using that soap and water underneath the sink. It's very helpful. Or if you want to hum, whatever is more convenient for you. Masking is still very important. I just bought myself new masks the other day that I still wear on public transport. It's your choice. This is me almost 5 years out from the height of the pandemic, and I'm still wearing a mask. So if that's what feels comfortable to you, please continue to wear your mask outside of a hospital or healthcare setting. It's really fine. And then to top it off, vaccination. This is really what's helped bring down numbers of the affected and hospitalization and like really sick folks. This is what has helped bring down our numbers significantly and what's helped us be in this post-pandemic phase. The vaccines. And I just want to be clear that vaccination doesn't necessarily prevent you from getting COVID. What the vaccine is helpful for primarily is reducing the chances of you going to the hospital and reduces the chance of you having severe COVID. I myself have gotten COVID once, despite being appropriately vaccinated, but I have never been to the hospital and I do not have long COVID. I always like to show the trend of where we are now. This graph is showing from March up until now, the end of May, how many cases of COVID that we've had in New York City. So as you can see, we really hit the height of this season in March through April. You can see the graph showing more numbers climbing up, but then now that we're in May, the numbers are going down, which is great. And part of the reason for that is high virus season typically starts in around October up until April. So we are going the expected path, but I just did want to show you all that COVID is still a thing. And aside from new cases, we can see that people are still being hospitalized for COVID. But if you look on the far left with the numbers in this case, notice how the numbers here are 30, 60, and the top being 90, versus on the previous slide, we were in the hundreds. This is to show you that, yes, people are still getting COVID, but the number of people going to the hospital hospital for COVID is much less than the number of cases. This is really down to the vaccines that people are getting, the fact that people are practicing good hand hygiene, the fact that some people are wearing masks. We've really gotten to a place where, thankfully, the number of cases is not equivalent to the number of hospitalizations. And now that the number of people going into the hospital because of COVID are less. Unfortunately, I just want to still highlight that we are still having people dying from COVID. But again, if you look on the far left, the number of individuals being 5 and 10, this is much less than what we were seeing on the previous graphs, where we were in the hundreds, where we were in the tens of tens. We are now having less than 5 people a day dying of COVID, whereas at the height of the pandemic, we were having hundreds, if not thousands of people die by the day. So we've really come a long way, but we've come a long way in part because people are practicing the appropriate recommendations that the scientific community has given us. And again, the appropriate recommendations are vaccination, hand washing, appropriate hand washing, and if you still desire, the masking. And so how are we still looking out for COVID? The CDC experts, folks, they're monitoring the changes of the different strains that we have in the season. Just think of a strain as a particular wristband of identification that each coronavirus has. Coronavirus isn't just one type of virus. It gets really smart and mutates itself and has different ways it identifies itself because it wants to get smarter than the vaccine that we all keep making because, hey, it wants to survive. It's also a living organism. But most of the virus strains, as I've been saying, keep changing. And so as it changes, we have a new vaccine in development. Aside from testing in a healthcare setting by a throat swab or a nose swab to help you identify whether or not you have coronavirus, how CDC and other experts monitor the virus is actually in your wastewater. This is going to be a little bit grimy, but in your stool, we shed parts of the virus when our body's getting over an illness. And so that wastewater is analyzed, and that's how the CDC tracks what type of strain is very active in certain areas. And based on what's in the wastewater, that's how they help create the vaccines preemptively rather than retroactively when it'll be too late. So that's why we keep hearing that, oh, there's a new coronavirus vaccine. It's because they're doing all this analysis and are trying to understand the most common strains early enough so that they can produce the vaccine. And so that's why you keep hearing of all these variants, like the flirt variants, the JN1 variants, and so on and so forth. This is a bit of a complicated slide, but I'm going to walk us through step by step. But before, I would like you to just hear me out on a couple of interesting statistics. Part of the reason why the vaccine is so important is that it really reduces your risk of critical illness. For adults 18 years and older, in 2023 through 2024, the COVID-19 vaccines reduced the risk of critical illness by almost 70% in the first 2 months after vaccination. Now, the protection decreased over time, and during 10 months after vaccination, the vaccines reduced critical illness to 50%. So in the beginning stage, you had 70% of the chance that it would reduce critical illness. And then 10 months after that, you had a reduced critical illness risk by about 50%. So that's critical illness, 70% right after vaccination and 50% right after vaccination. Now, in terms of being hospitalized for folks 18 years or older, in the 2023 to 2024 COVID-19 vaccination data information, your risk of hospitalization within the first 2 months after vaccination was reduced by 50%. If you're 18 or older in 2023, 2024, if you got the vaccine within 2 months of getting the vaccine, your risk of going to the hospital reduced by 50%. This is a really big deal and a really important fact to know. After 10 months, your risk of going to the hospital compared to somebody else who did not have the vaccine was reduced by 30%. So the vaccines, again, are doing some really important things. I'm going to take this piece by piece. So first, let's look at the very bottom where you're seeing the dashed lines with hospitalization. If you look at the hospitalization portion, so that's the gray, blue, and burgundy dashed lines, that's focusing on hospitalization. And if you move more to the left of that, this is critical illness. That's the full lines. And so by the gray color, this is information for people who just got like one dose of the vaccine. And the blue color is people who got two doses. And the burgundy color are folks who didn't get the vaccine at all. So now going up to like the full graph, on the left side is vaccine effectiveness, meaning how strong and how robust and how good the vaccine is for you. And then on the bottom portion of the graph is like days since last dose. I'll just simplify it to 1 week, 2 weeks, 2 months, 3 months, 6 months, so on and so forth. I'll focus first on the dashed lines because I think that's going to be easier to understand first. So in terms of hospitalization, so again, people in the hospital, the vaccine was very effective in the early days after you got it. In terms of people who were in the hospital, yes, you see the vaccine effectiveness decreasing over time, but it was still very good for you. It still seemed to be very effective in the early days. As time went on, the vaccine was less effective. But if you can see, folks who had one or two vaccines, again, the gray and the blue lines did much better than the people in burgundy who did not have the vaccine at all. So this is showing you all that, again, the vaccine effectiveness was very good in people who were hospitalized, especially compared to those who didn't get the vaccine at all. Their outcomes just weren't as good. So this is again showing you gray and blue. If you were hospitalized, either you got the single vaccine or the double vaccine, the vaccine effectiveness was very good for you. You were more robust in being able to fight infection compared to someone in burgundy who didn't get the vaccine at all. You just weren't as well protected. So that's people who were hospitalized. Now, people who had critical illness, these are now the full like dashed lines. Again, the vaccine was very helpful for those folks who had critical illness, who had either one or two vaccines. It's a little bit shaky when we get to the folks who didn't have any vaccines if you're comparing 2 doses to 1 dose. But again, at least having 1 dose was very helpful. The aspects that I want you to focus on are the ones that are in the red boxes. The statistic that I want you to hear before we go over the boxes is that if you are 65 or older in 2023 or 2024, the COVID vaccines reduced the risk of critical illness. So like going to the ICU or God forbid passing away in older adults by about 67% in the first 2 months after vaccination. That's greater than half the time. And then 4 to 6 months after vaccination, the vaccines reduce critical illness by about 40%. And then in general, any adult, still in the 65% or older population, in terms of hospitalization, it reduced risk of hospitalization by 50% in the first 2 months getting the COVID-19 vaccine. And then after 4 to 6 months, the effectiveness of the vaccination does wane. This is why we were encouraging multiple doses on the vaccine. The big square in red on the left side, it's a lot of numbers, but I just wanted to show you the total number of people on the top who got their COVID vaccines, how their risk of hospitalization over time. If you had the COVID vaccine in the early stages, so now I'm going to shift more to the right side of the graph, you were very well protected. But then as the days go by, if you notice the plot of the graph is moving more to the left, because the vaccine becomes less effective, that's why we're moving more to the left. But you can see in the early stages of vaccination, you're very effective. Those are folks ages 18 to 64. In the folks aged 65 or older, again, we're seeing that people are getting their vaccines and then also the effectiveness is reducing over time. But then again, this is why you get repeat dosing. I would like to point out that these are data from like 2023, 2024, and now we have more updated vaccines. So this is why we were encouraging in those stages to please get your booster, please get revaccinated. And remember, part of the reason why the vaccine effectiveness changes is these coronaviruses get smarter and smarter each time and change their identification and try and evade the vaccine because they're smart living organisms too that want to survive. This slide is just to show the different types of vaccines. you get your first dose of either the Pfizer or the Moderna. And then if you're continuing with the Pfizer, you get your next dose in about 3 to 8 weeks. And then that's your first part of your series. And then you continue with your boosters. With your Moderna, you get your first dose, and then 4 to 8 weeks later, you get your second dose, again, part of your primary series. And then you get your boosters afterwards in the months that follow. How do the mRNA vaccines work? Just to give a brief understanding, think of it like this. People love to meal prep. They order like from whatever food service is their choosing. But think of it that you're asking for help from a meal prep service, but you have your own ingredients at home. So you just have the recipe there because you're like, oh, I want to try something new, but you have your own ingredients at home. That's basically like how an mRNA vaccine works. The vaccine provides the instructions, but your body already has the tools to be able to make the antibodies to help fight the virus. And so the mRNA vaccine provides the instructions. Your body's like, oh, okay, this is how I make the antibodies to help me fight it off. And then your body creates its own antibodies. But notice how this happens because you need the mRNA vaccine. Yes, your body can produce its own immunological response if you have the appropriate strong immune system, but the vaccine is just so much more robust and effective. This is why we strongly encourage the vaccine because, hey, if you could make the great meal yourself, why would you ask for the meal prep? But you have something here to help you and it's an effective tool, so then you'll use it. So the vaccines really do give your body the extra boost to be able to fight off the infection more appropriately, especially if you are an immunocompromised person and your immune system can't do it as well. The vaccine is certainly indicated in those instances as well. So whether you are immune strong, immunocompetent, or immunocompromised, a weaker immune system, the vaccines really get you to the next stage of effective health. This is an older slide, but I just really did want to show that people are getting vaccinated across the boroughs, with Manhattan being the number one out there. People are getting vaccinated. Millions of them, actually. Millions of them have at least one dose, and millions of people still have even completed like their entire like primary series. This is just to really encourage the more people who get the vaccine, the less coronavirus spreads to others, because you're not just protecting yourself by getting the vaccine, you're protecting others in your community by minimizing your chance for like critical illness and minimizing your chance for hospitalization, minimizing your chances of passing the virus to somebody else. Those who are most at risk are folks who are less than 5 years old, greater than 65 years old, pregnant people, and people with like chronic lung disease or heart conditions, even diabetes. And as I keep mentioning, COVID vaccination doesn't necessarily guarantee 100% prevention, but it really does reduce your risk of critical illness, meaning going to the hospital, being in the ICU. The vaccines are readily available at your primary care office or your local pharmacy. And babies can get the COVID vaccine too. The earliest age is 6 months of age. And then depending on your age, the vaccine type, and your health status, meaning whether your immune system is strong, your immune system's on the immunocompromised side, or your other health conditions, that'll determine the number of vaccines the individual needs. You need at least 2 shots to be part of the primary series, and then you need at least 1 booster afterwards. And most people complete the series within 6 to 8 months, so why not? Please ask your physician or primary care provider about the vaccines, COVID symptoms, as well as testing. And it's not just the COVID vaccine that we should be aware of. As of now, I have not heard of a 2025 booster available, but the boosters are available depending on the year. Youngest age is 6 months old that can get it. And not just for the COVID vaccine, your flu shots. Flu season is technically out now. 2026 flu season actually starts in October-ish of this year. So please also start thinking of getting your flu shot later on this year in October. And then the RSV, the respiratory syncytial virus, you get 1 shot if you're over 60. And then also your pneumonia vaccine, high-risk individuals who are either older than 65, pregnant, or have immunocompromised state, such as cancer, HIV, diabetes, heart disease, you get 1 dose dose between the ages of 19 to 64. That would really apply to like the bottom portion of the high risk. And then all adults over 65, you all get one. Please join us at Settlement Health if you have any health concerns or need to see primary care provider. We're located on 106th in between 2nd and 3rd Avenue. That's our phone number, and that's my card on the bottom right. I know some of the slides were a little bit more complex, but the reason why I wanted to show you all those graphs was people keep saying, oh, the data says, the data says, the data says, but it's very hard to accept or even understand the data if you don't see it yourself. So that was part of the reason why I wanted to show it. And I will be honest, it is a bit confusing, but the points that I wanted folks to get out of it is the vaccine is effective, and the vaccine is especially effective in the early days that you get it. Yes, the vaccine effectiveness can wane over time, but that's not the vaccine's fault. It is because these strains are very smart and try and avoid getting killed by a vaccine because they're living organisms and they want to live. However, this should not discourage you from getting the vaccines because, as you saw in those graphs, they really do reduce your risk of having critical illness and going to the hospital. And as you saw from the earlier graphs that I showed, we are not in the same stage as the early stages of the pandemic when we had thousands of cases by the day, hundreds and thousands of people dying daily. We're really in a different place where we have much less people in the hospital, much less people dying. And it's really thanks to vaccines, good hand hygiene, if you prefer mask wearing.